I'm John Halamka, president of Mayo Clinic Platform. Mayo Clinic is the preeminent hospital system in the United States, 154 years, always puts the patient first. A unique culture and a unique approach to serving medical care for over 10 million people. Before I became president at Mayo Clinic Platform, I served as the chief information officer of Harvard Medical School, Beth Israel Deaconess, and the care group system in Boston, and have worked extensively over 2 decades on such issues as regional data sharing and creating new mechanisms for collaboration, for bringing partnerships together across payers, providers, and patients. I am an emergency physician by training, but also an MIT Course 6 graduate engineer. And so it's that working at the margins between healthcare and engineering and IT that has been my claim to fame. What I found in working in life sciences for the last 20 years is there were certain, I'll call it areas of friction in innovation in life science. So for example, bringing partners and collaborators together, working on common data sets, creating unique IP, sometimes took 18 months of lawyering before you even began the innovation. So the question at Mayo Clinic was, how do we create an ecosystem of collaborators and data generators and bring everybody together with very little friction in very short time? How do we do this? Well, we started by taking the entire corpus of Mayo Clinic data, 154 years of data on 10 million patients, de-identifying it, and then bringing it together into a secure container in Google Cloud and creating subcontainers so that innovators and collaborators could come in and work with the data to generate new algorithms, validate algorithms, create new insights, but not take the data out. So the data was never outside of Mayo's control. And that idea of a set of agreements, templated legal constructs, plus cloud-hosted de-identified data has enabled us to grow very rapidly and bring together a worldwide network of folks working on innovation. So today we have over 160 partners. We'll have, this year, 2023, we'll end up with 8 distributed data network partners, and we will impact 20 million patients in 2023. So far, so good. Now, there is a value generation or value capture side to this too, which is that as we bring on innovators, if they're smaller companies, we may take a small amount of equity in those companies. Or if they're larger companies, there may be a subscription model or revenue sharing. And so working together so far, this has created a significant impact to Mayo's balance sheet, as well as its innovation inventory. The 10-year plan from 2020 to 2030 at Mayo Clinic is called Cure, Connect, Transform. And so that means the 75,000 employees of Mayo Clinic globally are working on ways, of course, where we're going to serve our patients. We're going to be digital first, but we're also transforming the nature of healthcare delivery. So what does that mean? With Mayo Clinic Platform, think of it as a 3-sided marketplace of solution developers, data network partners, and health system delivery partners. So that means that we take the greatest innovators in government, academia, and industry. They generate novel algorithms, and novel mechanisms of doing diagnosis and treatment using this large corpus of de-identified data. But even the 10 million patients of Mayo is not enough. So we've signed agreements with Mercy Health, and Mercy has brought 15 million patients from Arkansas and Missouri and Oklahoma. And there's a litany of other partners that in 2023 will come on board. And so with that, novel algorithms, now over 60, a number through FDA, breakthrough, or EUA, and data partners coming on, increasing the depth, breadth, and heterogeneity of our data, we are now able to deliver these starter packs. The idea of AI at scale delivered in healthcare institutions and workflow. Mayo Clinic has 73 community hospitals, 37 affiliated health systems. And in 2023, we're moving all this AI into production in those sites. But we've also created advanced care at home and cancer care beyond walls. The idea of being able to deliver highly advanced, complex care in your home. And we've discharged over 20,000 patients to date with the same safety, quality, and outcomes of a bricks and mortar stay. So think of Mayo Clinic Platform as that facilitator that brings the solution developers, the data generators, and the health system delivery together with great agility and a lot of empowerment to get over some of the barriers that I've encountered over the last 20 years.